All right, so a very good morning, good afternoon, and good evening to everyone from wherever you are joining. Welcome to today's session of our short course on COP29. Am I audible to everyone? Can you hear me?
Yes, yes.
Yes, you are.
All right. So the topic of today's session, which is the seventh session of this short course, is health in UNFCCC negotiations, okay? And we're delighted to have our resource personnel, Dr. Kristine Belesova, with all of us here. So she's currently the senior lecturer in global population health at Imperial College London. So before starting off with today's session, I would like to give a very brief introduction about our resource personnel, Dr. Kristine Belesova. Dr. Belesova is a senior lecturer in global population health at Imperial College London and a leading environmental epidemiologist with expertise in planetary health. Her research explores the impacts of global environmental changes, such as climate change, biodiversity loss, and land use change on human nutrition, food security, health, and development. Increasingly, her work focuses on identifying, implementing, and evaluating solutions that address these environmental challenges while simultaneously improving population health with a particular emphasis on low and middle income countries. Dr. Belesova currently plays a pivotal role in the leadership of NIHR Global Health Research Center on non-communicable diseases and environmental change, focusing on transformative health solutions in India, Bangladesh, and Indonesia. At the center, her research includes developing and evaluating interventions aimed at addressing coastal water salinity in Bangladesh and advancing sustainable public food procurement systems in India. Previously, Dr. Belesova co-directed the Center on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. Her broader research interests include the cascading effects of environmental changes and the development of innovative approaches for analyzing and monitoring these impacts. She combines epidemiological methods applied to cohort and panel data with Earth observations, machine learning assisted evidence synthesis, and mixed methods evaluation. Dr. Belesheva is also passionate about using transdisciplinary and participatory stakeholder engagement methods to co-design, implement, and assess transformative solutions to environmental challenges. She has contributed to high-profile initiatives such as the Lancet Pathfinder Commission on Pathways to a Healthy Net Zero Future, the Lancet Countdown on Health and Climate Change, the Complex Urban Systems and Health Consortium, the Planetary Health Watch Monitoring Initiative, and the DFG Research Unit on Climate Change and Health in Sub-Saharan Africa. Through her work, Dr. Beleshova continues to make significant contributions to addressing the health impacts of global environmental changes and advancing sustainable health-centered solutions worldwide. So with these few words, I now warmly invite Dr. Kristine Beleshova to begin her session. Dr. Kristine, the floor is all yours.
Thank you very much for this generous introduction and for inviting me to give an overview of health in UNFCCC in English health course. So to start with, I will emphasize that health is affected by climate change in many different ways, as you can see in this diagram. The increase in greenhouse gas emissions are altering our climate, are leading to altered rainfall patterns, sea level rise, and extreme weather, all of which are translating into flood events, heat waves, drought, and fire events that are then affecting our health directly, but also indirectly by altering ecosystems and social systems and leading to a range of different health outcomes, including cardiovascular diseases, respiratory diseases, vector-borne diseases, as well as impacting our mental health and nutrition. However, acting on climate change does not only prevent these sort of longer-term impacts on health, it can also generate immediate co-benefits to human health. So, for example, reducing the burning of fossil fuels reduces not only the emissions of greenhouse gases, but also lowers air pollution that is co-emitted together with the greenhouse gases in the burning process of fossil fuels. Thereby, by improving the air quality, we're also reducing the risk of respiratory diseases, various cardiovascular conditions, and hence benefiting human health. At the same time, if we eat less red meat, which is a very big source of greenhouse gas emissions, we're also benefiting our health by preventing the risk, by reducing the risk of cardiovascular diseases. And here in the diagram, you can see other pathways to these immediate health co-benefits from climate action. So throughout the history of global climate policy, the health community and particularly WHO have been engaged in the climate change debate and negotiations. We can see that the first WHO assessment of health impacts of climate change was released in the 90s, and various programs were then following that, and further estimates were released in the 2000s. The World Health Day also captured climate change, and then WHO presented a large conference on climate change and health just in the run-up of the COP in Paris. At the same time, we can see that IPCC has been capturing some of the health aspects throughout these years. The diagram runs only up to 2015, but of course, a lot of the activity, and in fact, most of the activity has happened after that. And that's what I will focus on today. And if we just compare the historical IPCC chapters on health in the IPCC report released in 1990, health had a fairly minor role in the whole report. It was included in the chapter 5 on human settlements, energy, transport, and industrial sectors. And essentially, it was presented in a way that indicated that health will be impacted, but the evidence base in terms of how exactly health will be impacted, to what extent, was quite slim at that time. And that comes to a huge contrast to what we know now in the latest assessment report, the sixth assessment report of IPCC. We have a very comprehensive chapter on the health, well-being impacts of climate change, substantiated by a very rich evidence base already. Also, when we look at the WHO engagement in climate change negotiations, of course, in Paris in 2015, WHO was present and very much following the extent to which health was represented in the Paris Agreement and how it was negotiated. Unfortunately, it only acquired then about 3 mentions in the whole agreement, but that comes to a very large contrast to what happened in COP28 in Dubai last year and what is happening now at the COP29 in Baku, where health is being majorly represented as the argument for climate action. And you can see in these images how representatives from WHO are championing this argument together with the COP29 lead negotiator and with other policymakers. So I will focus on some of the major highlights in the run-up to COP29 and COP28. And I'll first start with the establishment of the ATTACH. The ATTACH stands for Alliance for Transformative Action on Climate and Health, which is hosted by the WHO, and it was established at COP26 in Glasgow. And the Alliance has 5 working groups. One working group is focusing on financing health commitments on climate resilient and sustainable low carbon health systems. Another working group is focusing on climate resilient health systems. The third working group is looking at low carbon health systems. Fifth working group is focused on supply chains. And the fifth working group is focusing on climate action and nutrition. And why is ATTACH necessary? Well, the healthcare sector, as we know, is contributing about 5% of global greenhouse gas emissions. So it's essential to tackle the emissions coming from the healthcare sector. At the same time, only 28% of ministries in low and middle income countries were actually receiving international funds to support their work on climate change and health, which is definitely an underinvestment. And the ATTACH, way back when this graphic was produced, was joined by 84 member countries. Now there are more countries part of the ATTACH, over about 90. And that provides a wonderful platform for the countries to assess how their healthcare systems could be transformed towards more resilience and also towards net zero. And you can see here the details of what are some of the focal activities on the side of resiliency, but also low carbon efforts. So, for example, it touches supporting member countries to conduct the climate change and health vulnerability assessments. It's also helping to develop the health section of the national adaptation plans, and also attaches helping countries to access climate change funding specifically for health. On net zero side, the Alliance is helping countries to achieve their net zero emissions, set specific targets, and assess perform baseline assessments and come up with concrete action plans. Another major highlight comes from COP28 last year in Dubai, and that is the Climate and Health Ministerial. It was the first ever Climate and Health Ministerial at a COP, which is essentially a meeting of ministers of health and the ministries to discuss climate and health. And the meeting was attended by 52 health ministers, which is actually more than the number of all health ministers that, well, about the same number as all health ministers that ever attended all COPs before, if we sum up the numbers of attendance. And overall, there were 110 health ministries represented, and of course, much more health sector representatives were present, almost 2,000 of them. And there was also a call released by over 40 million health professionals to prioritize health at the COP. And as you can see in the picture, each country was given a limited amount of time to state their commitment on climate and health and how each country is going to address it. And you can also read a bit more about this meeting and the representation of the health sector in COP28 in this article by Van der Leen and others. So COP28 resulted in a landmark declaration on climate and health, and you can see that this declaration had 8 objectives. The first objective focused on strengthening the development and implementation of policies that focus on climate and health. The second was facilitating collaboration across sectors of environment, human health, animal health, and climate change. The objectives were focusing on recognizing that healthy populations are really contributing to climate resilience, but they're also the outcome of successfully adapted systems. The fourth objective was focusing on enhancing the ability of health systems to anticipate and implement adaptation interventions against climate-sensitive diseases and health risks. The fifth objective was focusing on promoting comprehensive response to climate change impacts on health. The sixth was focusing on inequalities. The seventh objective focused on curbing emissions and waste in the healthcare sector. And the eighth objective focused on interdisciplinary and transdisciplinary research, cross-sectoral collaboration, sharing of best practices, and monitoring progress at the climate and health nexus, including through the Attach Alliance that I've covered before. Another landmark document from COP28 were the guiding principles on financing climate and health solutions. And in this document, there are 10 principles covered. The first is focusing on accelerating transformative climate and health solutions to improve lives now and in the future. The second is focusing on supporting climate and health priorities for the most impacted countries and communities. The third is focused on promoting inclusive and equitable approach to financing climate and health solutions. Subsequent principles focused on mobilizing financing from all partners, on building the core policy making and implementation capacities, on embedding climate and health goals across the different financing strategies, ensuring equitable access to finance, supporting holistic approaches that include health, as well as innovation and scientific research and development, and promoting the alignment of the financing for climate and health solutions with the broader efforts to transform international financing system. So to sum up, the COP28 in Dubai achieved a number of milestones. So at the time of the COP, the Climate and Health Declaration was endorsed by 123 countries. Now this number has increased, and there are already 150 countries who have endorsed the UAE Declaration on Climate and Health. We also see that the financing principles were endorsed by 41 countries and partners, and funders announced that they committed $1 billion US funding to address specifically climate and health crisis. So after COP28, there was a spur of further activity in the run-up to COP29. And one of the achievements was the climate change and health declaration, or the precise, which committed the WHO to make climate and health one of its 6 strategic objectives for the coming years. And the resolution is really a uniting moment for many countries to acknowledge the importance of this aspect, and you can read more about it in the document. The next highlight is that all the way back, just in the run-up for COP28, the WHO assessed all of the country nationally determined contributions in relation to how well they're addressing climate and health. And in that assessment, they found that 91% of all the NDCs already included climate and health considerations, and the inclusion of the health considerations in NDCs had increased compared to the earlier versions of the NDCs, and the health co-benefits of climate change mitigation action were included in about a third of the NDCs, so there's still scope for expanding the inclusion of the health co-benefits. Unfortunately, only 10% of the NDCs quantified what these co-benefits are, and only 11 NDCs included emission reduction commitments for the healthcare sector, so another area for improvement. 63% of NDCs had health-specific adaptation action plans, and sort of various aspects on how they're going to build their health systems in a more climate resilient way. And 29% of NDCs allocated climate finance to specific health actions or plans. However, only 11% were unconditional finance targets. Now, having had that assessment just before COP29, WHO released the new quality criteria for healthy NDCs. So now we have a set of guidelines that informs us on how exactly countries can tailor their NDCs in a way that capture health aspects in the most adequate and productive manner. And here you can see an example of how these recommendations are structured for 2 aspects of the NDCs, for mitigation and adaptation. So, for example, for adaptation, WHO is recommending to set health as a priority sector, and also to include specific adaptation targets in the health determining sectors, and to identify synergies between mitigation and adaptation for health. And you can, of course, find this report online and look at all the other recommendations made by the WHO. Another important release just before COP29 is the annual Lancet Countdown report. And this report monitors the progress on climate and health. And it releases a publication in the Lancet, and of course a lot of communication materials, policy briefs, which are all based on a very comprehensive set of indicators across a range of domains, from the impacts of climate change on health to health and climate change adaptation to health and climate change mitigation, and also sort of media aspects and communication aspects. So how much is climate and health featured in the public debate and in negotiations in the media, etc. So I encourage you to take a look at the report. And here you can also see one of the key findings of the report. This year, in the graph, you can see how the heat-related deaths in the age group of over 65 years have evolved from 1990 to 2023. And you can see the actual numbers in the represented in the red line, and the sort of the counterfactual, the deaths that would be expected without temperature change, so without climate change, represented in the blue line. And you can see that from 1990s to 2023, in 2023, we can see quite an appreciable split and the difference in these two lines. So it tells us that climate change is significantly contributing to mortality in this age group already now. Another important report with a set of recommendations was released by the Global Climate and Health Alliance. Global Climate and Health Alliance is mobilizing the global health community on climate crisis, health, and equity. It was formed in 2011 in Durban, and in 2015 it admitted over 1,700 health organizations and 8,200 hospitals and healthcare facilities. They also gathered 13 million signatures from their members in a collective agreement on the need to address climate change. So it shows really a very powerful voice of the health community on climate change matters. And for COP29, their recommendations included implementing mechanisms on reporting progress in relation to the UAE COP28 declaration on climate and health. They were also calling for policy coherence, for enabling finance, for just energy transition and health considerations as a part of that, for holistic adaptation that takes into account mental health and well-being outcomes as well as physical health outcomes. They further called for supporting the quantification of health losses and damages in the loss and damage response. And they also called for prioritizing food and agricultural aspects in resilient, sustainable agriculture and ecosystems debates. They called for enhanced integrity with health considerations, and also for a collaboration with the most impacted communities to support their health and well-being. Another report was released by the World Health Organization. It's their special report on climate change and health, and it is focusing on health as the argument for climate action. So a lot of the WHO-run events at the COP29 were really pushing for health as the argument for climate action. And here you can see their iconographic showing why we should be focusing on health as the argument for climate action. And it's based on these three pillars of the planet, the people, and the place. And the planet pillar is linked to improving governance, and that takes into account health considerations, transforming financial systems and the economy. The people pillar is linked to unlocking human development and putting people at the heart of climate action, as well as on building future-proofed health systems. And the place pillar is really calling for nature and biodiversity being the foundation of our health, and for cities to be transformed to unlock climate and health co-benefits. And now some of the key highlights of the actual COP29 event. So the first highlight is the signing of the letter of intent of the Baku COP presidency's Continuity Coalition for Climate and Health. So this coalition includes Azerbaijan, Great Britain, Egypt, and the United Arab Emirates, as well as Brazil. And it is really a very high-level initiative to show commitment, continued commitment, that will guide global climate and health initiatives towards COP 2030 and beyond. Another highlight was the high-level roundtable on climate and health that was hosted by the WHO, Spain and Azerbaijan. And a number of issues were discussed at this roundtable. The first was the question of how to operationalize climate and health financing. Second, there were a number of climate and health synergy success stories showcased across the countries. The third topic was scaling innovative financing mechanisms for climate and health. And the third topic was strengthening country-level collaboration on climate and health. Another highlight is that Azerbaijan became the attached signatory and co-organizer. As I've already mentioned, attached has already over 90 members, 90 signatories, and Azerbaijan will now be the co-organizer of the alliance from 2024 to 2026. They also hosted a whole day of attached-focused events in the WHO Pavilion, which is a very rich and very informative set of sessions, and you can access the recordings of all these sessions on the WHO website. And finally, as a part of the Human Development Day, we see that the Baku Initiative on Human Development for Climate Resilience was signed and set. In the past, various COPs have made progress on issues on different issues of human development separately, but now we see that there's this coalescence and synergies are being recognized between different foci of human development, from education, health, green jobs and skills, and children and youth. So the statement recognized that and brought these different themes together. There was also a release of the principles on human development for climate resilience. And you can see that there were 12 principles. You can see the first 6 of them on the first slide, and the next 6 will follow on the next slide. And the first principle is aligning climate action with human development for a resilient future. Second, enhancing social dialogue, partnership, and collaboration in human development policies for climate response. The third is investing in integrating quality climate change education. Fourth, building climate resilient low carbon education systems. The fifth was on enhancing support to green skills, qualifications, and occupational standards in priority sectors. And the sixth, investing in entrepreneurship, innovation, and talent for the application of new green technologies with job creation potential. The seventh principle focused on promoting integrated climate and health surveillance and early warning systems. Eighth was focused on building climate resilient low carbon health systems and healthcare facilities, including supply chains. The ninth prioritized children's unique vulnerabilities to climate change and called for investment in climate resilient and sustainable essential services. 10th principle focused on strengthening adaptive social protection systems to build resilience for all, especially the most vulnerable. The 11th principle focused on investing in solutions for communities and migrants affected by climate change, and the 12th focused on scale up of public, private, and innovative financing solutions to strengthen human development for climate resilience. Another highlight at COP29 was the operationalization of the investment platform. So the Health Impact Investment Platform was established earlier this year in the summer by the World Health Organization, European Investment Bank, Islamic Development Bank, and African Development Bank, as well as the Inter-American Development Bank. And it's very much focused on strengthening the primary healthcare and health system resilience in response to various shocks, including climate change. So at COP29, they focused on how to take this forward. And there already is a commitment by the founding partners to make over 1.5 billion euro available through concessional loans and grants to strengthen primary healthcare and health system resilience. And you can see some of the key principles that are covered in the document here on the slide. I will not go into details on those, but please do take a look at the document, which is, as all of the other documents I mentioned, publicly available. And of course, there's a wide range of further documents that countries, organizations, and individuals can use to help them work on climate and health issue. There is the wonderful guide by the WHO on how to operationalize resilient health systems, how to include health in the climate change adaptation plans. There's also a review of how well countries have included health in national adaptation plans so far. And there's a wonderful set of materials by the WHO on how to integrate health in all policies, in the policies of all sectors, which is a large initiative championed by WHO for a while now. So what's coming next? We're next awaiting the COP30 in Berlin, which will potentially be a landmark year for the health community yet again, following COP28. And in general, there is a push from advocacy organizations, including the Global Climate and Health Alliance, to focus on health and have the health ministerial meeting every 2 years. Berlin would be the next sort of 2 years event after COP28. Also, countries are now releasing their nationally determined contribution plans, and we're hoping to see many more healthy NDCs now with the WHO guidelines for the quality of health integration into NDCs being released. We also are anticipating that the UAE Berlin work program on indicators for adaptation will include health indicators under the global goal on adaptation. So that's something to watch out for. I've already mentioned the ministerial, and in general, we're looking for much more progress on climate and health financing. Back in COP in Paris, health financing was a tiny slice of the whole climate financing pie. So now we really look forward, and many actors are working on increasing that fraction that is directed at the synergy between climate and health action, because indeed there are many synergies between action on climate change and health. And as WHO this year has been championing, health is the argument for climate action. So thank you very much. That comes to the end of my talk today. Feel free to get in touch, follow the NIHR Global Health Research Center that I'm part of on X, as well as myself. And I'm welcoming any questions.
Thank you very much, Dr. Kristine, for your informative and enlightening presentation. And now the floor is for our participants. If you do have any questions, you can put it in our chat box, or you can raise your hand however you want to do it. Thank you very much. I think, Kristine, we can wait for a few minutes till our participants write the questions in our chat box. All right. Dr. Kristine, we do have one of our participants got a question. It's Miss Mariana. She wrote that overall climate funds, GCF-AF, have a relatively few projects related with health. Why is that? And is this not a priority?
Yeah, thank you, Mariana. It's a very good observation indeed. As of recently, GCF and Adaptation Fund did not used to have very many projects focusing on health. Although that is changing and shifting, and there is an increased focus in GCF and Adaptation Fund on the health sector. However, now I think we should see also further transformation in their approach and in the fraction of funding that is devoted to not just the health sector, but also health promoting activities across various sectors. Now GCF is really raising to this issue that health needs to be integrated in climate action, as in adaptation and in mitigation. And there are many different health aspects that need to be taken into account. I have seen myself in the previous GCF applications and follow-up reports how initially the health ministry is part of the project, but it sort of gradually disappears from the monitoring updates. But we really hope that this is going to change and there's work being done in that area. It's just a matter of, I guess, a slight time lag before we see that in the grants that get issued by these organizations.
Thank you very much. Any more questions?
Can I ask one, Rayatul?
Yes, please. Professor Hafizur Rahman,
Okay,
sir, please go ahead. Yeah.
my name is Hafizur Rahman. I'm the professor in the Environmental Science and Management Department, Independent University of Bangladesh, and also I worked in the past in NIHR Scotland for 3 years. Anyway, uh, thank you, Christian, for your nice presentation. Just I am asking a little bit far from this topic. I have heard from Rayatul that you have worked in Bangladesh, India, and this region. Can you mention which type of work? Have you done any work on heat stress or salinity or environment related with the health in Bangladesh?
Yeah, absolutely. Thank you very much for that question. As a part of the NIHR Global Health Research Center on Non-communicable diseases and environmental change, we work on various issues at the intersection between environmental change and health in India, Indonesia, and in Bangladesh. In Bangladesh, we collaborate with the DRB, and we focus very much on the water salinity and the health risks caused by water salinity in coastal areas of around Khulna and Satkhira. So we are now conducting comprehensive assessments of the levels of water salinity and communal drinking water sources in that area. We are identifying what technologies have been used to address water salinity and benefit health, as well as primary healthcare facilities in that area. And together with and local stakeholders, we are now entering into a phase when we will be co-designing appropriate solutions to address these risks and also strengthen primary healthcare system. We will then have a few years to evaluate any solutions that we implement together with local stakeholders, and we'll be able to share our findings with the wider research and stakeholder community. In India, our work is focusing on a slightly different issue. There we focus on public food procurement systems, and in particular on the public distribution system, as well as midday meal program. And we're looking into ways how these systems can be shifted towards health and sustainability. So what interventions can we implement within these systems to make sure that their environmental footprint is reduced, and also that they cater for healthier, more diverse, and more nutritious diets for the beneficiaries. So one of the big issues is the provision of rice through the PDS, which is of course essential for food security, but unfortunately rice is overrepresented in the diets of many PDS beneficiaries, and we're looking for ways how to integrate other crops, other produce, for example, millets, but also improve the access to fruit and vegetable through programs such as PDS, so that the diets of beneficiaries become more diverse and cater for their micronutrient requirements, but also become more environmentally sustainable. Because as we know, rice is a major emitter of rice production is a major emitter of methane, which is a very potent greenhouse gas, but it also is quite strenuous in terms of water requirements and other issues. And just to complete my response, I guess in Indonesia, we work on the issue of plastic waste banning. So Indonesian government has forbidden burning plastic waste, but unfortunately it is still happening at a large scale. And we're, together with the local communities and stakeholders, we're trying to identify what solutions could be developed and implemented to address that.
That's huge, really interesting. Hope you will come again when in Bangladesh. We can have a chat together because my university is very near to the Dhaka airport and I'm originally from Satkira or Khulna. So that will be nice to meet you if you come again and if I know.
It'd
Thank
be a
you.
pleasure. So thank you.
Thank you very much, Kristine. Any other observations or questions from our participants? All right. I think, Kristine, we can call it a day since we're not having any more questions for today's presentation. Dear participants, you are always welcome to send an email to our resource person, Dr. Kristine Belesova. And I'll be sharing this recording along with the lecture materials after today's session, okay? So I'll be seeing all of you in the next session. Okay, until then, thank you and bye-bye.
Thank you very much. Goodbye.
Thank you. Goodbye.
Thank you.